Hey everyone, I'm Kartik and welcome to another episode of Mint Techcetra. This episode is brought to you by Abbott. We all probably know someone who is living with diabetes, whether it's a family member, a friend, or a coworker. It's becoming more and more common, and it's not just a condition people are suffering from in India, it affects people around the world too. Diabetes is a chronic and complex lifestyle condition that affects millions of people worldwide. Managing it on a daily basis can be challenging. This makes it important to raise awareness about the condition not just for those who are living with it and their families, but for the community at large. To discuss this, we have with us Dr. Prashanth Subramaniam, who is the Head of Medical Affairs, Diabetes Care India, and Ms. Sheryl Salis, who is a registered dietitian, founder and director, Nurture Health Solutions. Welcome to Mint Techcetra.
Thank you so much, Kartik.
So, to start off, my first question is addressed to both of you. How has digital disruption enabled easy monitoring and easy connection in diabetes management today?
Yes, Kartik, that's an interesting question. In today's time, digital technology has ignited a fundamental shift in the way people are managing their diabetes. And now, with wearable technologies coming in, and it's becoming very accessible, more and more people are using it for their convenience. For example, if you look at the CGM, which is the continuous glucose monitoring system, it's become, I think it's like a blessing, if you ask me, in my clinical practice at least. And I'm sure every doctor and every healthcare provider would agree because it has actually brought the person living with diabetes and us very close in terms of real time disease management, so to say, where we can actually look at their blood glucose levels in real time and give real time make real time decisions in terms of how their blood glucose levels are responding to different factors, and that only helps in improving the blood glucose control of a person living with diabetes. And CGM definitely helps us, in terms of gives us a kind of an understanding as to what is really causing this increase in glucose. Is it the food? Is it inactivity? Is it obesity? Is it stress? Inadequate sleep? There's so many factors which are responsible, and that really helps us pinpoint and make help the person make corrective actions. And if you ask me, when I started my practice 2 decades ago, even owning a glucose monitor was so difficult. It was so expensive, and people really didn't have it. They used to only rely on a 3 months average, that is the HbA1c test, and they used to go to their doctors only then and get some kind of correction in terms of their medication, etc. But I think today, with the digital technologies coming in, it really has made a world of a difference in terms of people now becoming, I mean, they know what their readings are, they know what is actually causing their blood glucose levels to go up. Compliance is definitely improving, and they are definitely more I would say involved in their diabetes management.
Fantastic question. So when we look at digital disruption, I mean, it's not just diabetes, but across. I mean, we order food on our phones now. We don't walk out of the house to hail a cab. So everything is on the phone. And that's also translated into healthcare. So within diabetes, it is now possible to know where our glucose is headed. This becomes much more important for patients who are on insulin, who need who need not necessarily go into hypoglycemia or low sugar. And keeping a watch on our glucose values helps each person with diabetes to ensure that they stay within range. In the context of glucose monitoring, continuous glucose monitoring is something that's come up of late. It's moved leap and bounds into how it's been developed and adopted into clinical practice. What this is essentially a continuous data stream which the person with diabetes can have a look at to understand where their glucose is headed and how does it respond to different food, for example, lifestyle, exercise, as well as the medications. All of this essentially helps every person living with diabetes to ensure that they're doing the right things to be in control of the situation while also enjoying life as they should.
Right. So, Dr. Prashant, how can CGM, also called continuous glucose monitoring, help people with diabetes, and what can be done to enhance awareness about CGM in India?
Well, two great questions. So one specific to CGM or continuous glucose monitoring, it's changed the way we manage diabetes. So it was essentially the use of glucometers or those blood lancing devices. You would get a droplet of blood on your finger, put it into a strip, wait for the meter to give you a value, and that's a point estimate. That's the glucose value at that specific point in time. Where is it headed? What's the impact of food that we've consumed? We wouldn't know unless we prick again. That's always been how we have managed glucose prior. CGM changes the whole equation. Now we know where the glucose is headed. We know how it's been. What's the response to medications, for example, the different food we consume? What's the response of going out for a healthy walk, for example? All of this is necessarily real-time feedback that the body is able to give you via the glucose values. It's changed a lot. Patients now are more confident of living with diabetes. It helps decision making in the sense you know what to consume, what you don't need to, or need to go low on with. For example, desserts, and how much of a dessert would I enjoy if I have to stay within range. And it's essentially helped the doctors also to monitor remotely. So earlier it would mean that you would visit a doctor's clinic every 3 months or 6 months to have a look at glucose data. Now you don't have to, nor is a need to enter a doctor's office. You just have to link up to the doctor's clinic via practice ID, and then essentially the glucose data which you have is then shareable with the doctor. So doctor can now look at your glucose trends and give you advice. Essentially, this is telemedicine.
Beyond glucose monitoring, what other steps can people living with diabetes take to actually address this lifestyle condition?
I would say that, we follow the ABCDEF of diabetes. Okay. So when we're looking at blood glucose, it's not only blood glucose, it's blood cholesterol, it's blood pressure. So all these things need to be kept under control. So A is A1C, which is your HbA1c, which is the average 3 months of blood glucose, which you would ideally want below 7%, but also knowing that, we do not have too many hypoglycemic episodes, which is causing the HbA1c to come down. Okay, so that is the A1C. Then is your blood pressure. Again, blood pressure should be in range, and then your blood cholesterol. So these are the ABC. And how do we achieve it? With the right diet, exercise, and most important is follow-up. How do you know that what you're doing is working? One is definitely you get to see the trends on your CGM, or you're doing your finger pricks. You do your blood reports. But then you have to go and follow up with the doctor to know that what advice he's given, or with the dietitian to know what advice she has or he has given you is working fine for you. Do I need to make tweaks? So that is where follow-up becomes again very important. So when we're talking about managing diabetes, I would say we should have a holistic approach. One is that it's not only the person living with diabetes, but everybody in the family needs to take care of themselves. So it has to be a family thing. It has to be a society thing. We have to, like you said, screen time is increasing and everybody's getting addicted. We're all connected on our phones. I think today nobody even picks up the phone to ask each other how they're doing, because we're looking at social media and we're assuming everything is going fine. So this is how the digital world is transforming us. But having said that, we can use it to our benefit as well. When we're talking about technology, we're talking about digitization. I think there's a lot of benefit as well in it. One is we have to look at what we're eating. Are we eating right? And there are set guidelines. We don't make too many changes or not too many deprivations, because otherwise the person who's diagnosed with diabetes is very deprived. Oh my God, I can't eat mango. I can't eat rice. I can't eat this. There's a big list of what not to eat and a very small list of what to eat. And the person is not motivated because, again, diabetes is something that they have to live for life with, so they have to have something which is more sustainable, easy to follow, very simple. So I think today, with advancement in nutrition science, also as a dietitian today, I can confidently tell my person living with diabetes that yes, you just have to make small tweaks, small modifications in your routine, and you will do good. For example, instead of taking a 12-inch plate, I could take a 9-inch plate. I fill half my plate with non-starchy vegetables, 1/4 of my plate with cereals, millets, or starchy vegetables like potatoes, and 1/4 of my plate with pulses, your protein foods like egg, fish, your dal, your chicken, or it could be curd. So just making this small change, I can actually moderate the amount of carbs I'm eating. include fiber, include protein, which is going to keep my blood glucose levels in control. I don't need to make too many changes. I don't need to change the way I eat, because if I'm from south of India, I know people love their rice. We're not going to ask them to give up on eating rice. But can I suggest what kind of rice to use, how much rice to eat, when to eat, and what to eat it with? If I give them those suggestions, they're going to comply. So adherence will improve. So one is definitely eating right. Okay, so I always tell my patients that follow the 80-20 principle. Eat till you're 80% full, keep yourself 20% empty. So, follow this. That way, your glucose will also be in control and also your weight will be in control. 80% of the time, eat home cooked meals. Because today, again, with all your apps, it's very easy to order and you don't really need to go out. And then you end up actually eating a lot of unhealthy calories, so to say. And again, a lot of carbs, bad fats, etc. So if I'm doing that right, cutting out on the processed, refined, the sugar, etc., and eating home cooked meals which are cooked in a healthy manner. And let me tell you, our traditional Indian food is extremely healthy. We just need to watch portions. So it's also what you eat and how much you eat. So, the focus should be on how much we're eating. Then we move on to exercise. Now, physical activity. In fact, we all know that India is a country where a physically inactive country, and therefore the Lancet data, which is really, which is just recently published, has shown us that we're not physically active. So even when we ask our, when people come and visit us, whether it's a client, patient, etc., we ask them about physical activity, they'll have 100 reasons. Now, it's raining, so I can't go out. Or, I got late at work and I can't go. I get very tired. I mean, there are so many reasons why we cannot be physically active. So very important is to incorporate physical activity. In fact, I tell my patients that physical activity is like insulin. It will help you manage your diabetes better. So most important, and again, if you don't find, say, 1 hour in a day to be physically active, can I break it up into, say, 4-5 different small sessions? Maybe, post my lunch, go for a walk down. If I'm in my office, and just go down for a stroll. Same thing in the evening, same thing post breakfast. If I'm, talking on the phone, I can easily walk and talk on the phone. So that way I'm being active. So, sitting is the new smoking, so to say. So, they say that if you sit for more than 30 minutes at a stretch, that itself is accounted for physical activity. So find reasons to be active. Find a good exercise buddy, somebody who's going to motivate and push you. We always have that buddy, to tell us, come out partying, do this, let's drink, etc., etc. But we need to have the good buddy as well, who's going to motivate to be physically active. So if you look at the WHO recommendations, it says at least 150 to 300 minutes of activity, moderate intense activity a week. So this is what we need to find time for. If you can't find enough time in the week, can I do more over the weekend? So, that's most important. And let me tell you, we see with our clients and our patients that the moment they incorporate physical activity, their glucose numbers really improve because their body fat is reduced. The muscle mass goes up, especially if they do strength training, coupled with the right kind of diet. And that itself makes the body insulin sensitive. And therefore, their glucose numbers also show a very positive trend. So we did diet, then there's exercise, and do whatever you like. Definitely strength training is something that we would encourage them at least 2 to 3 times a week. The other days can be cardio, maybe, do some activity you enjoy. But very important is to know that you do not overdo it. We're seeing a lot of people succumbing to heart attacks, etc. today, because moderation in everything that we do is important, whether it's diet, whether it's exercise as well. Some people go overboard. So we have, an extreme population. Some people don't do anything. And some people would spend like 2-3 hours in the gym every day. So again, we need to find a moderation or a balance. So that's important. Then sleep. I think this is the most important thing, especially in today's time. People go on the bed, but when are they actually sleeping? Because they're on their gadgets chatting. And we see that people are sleep deprived, including our children. And sleep is one of the biggest factors which can cause obesity, most importantly, adiposity, and that can lead to a lot of lifestyle conditions. So sleep is extremely important. So at least getting 7 to 8 hours, if not 8 hours, at least 7 hours of uninterrupted sleep. And for that, we need to be away from our gadgets at least before we sleep as well as after we wake up. So, use that time for physical activity, meditation, or whatever, keeps you calm and happy. And then comes stress management. I think in today's times, everybody is stressed. I have a lot of my patients ask me, do we have a pill that we can take and we are stress free? And I said, I wish I knew. I would have been the first one to take it. So while we can't really negate stress in our life, but yes, stress has a huge, huge factor to play when it comes to diabetes. And that's when, again, the CGM works wonders. Let me tell you an incident. I've had this patient of mine who's into sales. And every day at around 4 o'clock, I used to see that his blood glucose levels used to be high. And we were seeing a similar trend, over a period of time. And then I asked him, what happens at this time that your glucose is going high? Because you're eating fine, everything is fine. Your glucose is nicely coming down after you eat. And again, it's going high. So are you eating something at that time? And he says, no, that's the time my boss calls me up to know the sales numbers. So that's his time with his boss, and that stresses him out, and his glucose levels jump. And can you imagine even these factors, something that we would not even think of? So, stress can really play havoc with your glucose, with everything else. So, very important is mental health. And today we're seeing a lot of people being affected with mental health issues. So, that is something that we also need to focus on. So, everything. And as I said, holistic management becomes very crucial. And all of us working as a team. And definitely all these, digital technologies, whether it is your CGM device, whether it is the way you relay the data, etc. I think, you have so many other technologies, like you have the insulin pump for people who are on insulin. And a lot of that really helps improve, blood glucose control. So definitely, if you ask me, from where I started 24 years ago to today, it's really made diabetes management really easy, at least for us, healthcare providers, and also for people living with diabetes.
Doctor, could you tell us what are some key features of technologies like continuous glucose monitoring? Additionally, what role do they play in helping people make lifestyle changes to manage diabetes better?
So the technology essentially is a monitoring device, and it keeps a minute-to-minute check on where the glucose values are headed. The way it is done is there is a small filament which rests underneath the skin, and this has a enzyme coating on it, which essentially measures glucose in the interstitial fluid, which is a fluid just beneath the skin. By measuring the glucose values in this fluid, we are able to gauge where the glucose values are headed, related to, for example, food consumption, example, medications taken, lifestyle, exercise, whatnot. And by following up or looking at the trends of how the glucose data or the trends are evolving, patients can take better decisions to take care of their health. It's also essential that patients who are on insulin can use this device to stay on track with where their glucose values are headed, especially to prevent the occurrence of hypoglycemia or low sugar. Or, for example, anybody with diabetes wouldn't want to go into very high values of glucose, because this in turn leads to long-term complications such as heart attack, stroke, even as cardiovascular death. So here again, continuous glucose monitoring helps you stay within range. By range, there is a concept called time in range, which is the amount of time in a typical day that the person living with diabetes tends to stay within a specified glucose range. For most patients, this would be between 70 milligrams per deciliter to 180 milligrams per deciliter. And we consider this the green zone, where your glucose values should stay most of the time. There are recommendations from different guidelines and scientific bodies as to how much is recommended, and this is dependent on the person's particulars in terms of associated comorbidities as well. A ballpark or a very simple calculation would be to at least spend 70% of time within this range of 70 milligrams per deciliter to 180 milligrams per deciliter. What we are ensuring by doing this is keeping our glucose values in check, as close to where it should be when it comes to managing diabetes well. And this in turn is helping us avoiding a lot of complications in the future. So in the sense, glucose monitoring is not just looking at a value, but it also helps you avoid immediate complications such as low glucose events, especially in patients who are on insulin, and prevent long-term exposure to high glucose levels, which in turn may lead to cardiovascular events. So technology has definitely helped to make our understanding much better when it comes to diabetes management. It also has given a sense of empowering to the patients who live with diabetes. So, for example, a person with diabetes could be a child going to school with type 1 diabetes. It could be an elderly person at home being taken care by their spouse or daughter, son, whoever. It could also be a energetic office going professional who has to worry about the stresses at work while also managing their diabetes. So in the scheme of things, the requirements are different. I mean, the expectations of how tech can help are quite different. For example, in a child, the parent would also be worried about the glucose values while the child is away at school, playing, studying, whatnot. So the ecosystem is developed so much that now you can have remote access to where the glucose data is headed. So child being in school, wearing the sensor, scanning the sensor with a phone or with a reader, the parent can now have a look at where the glucose levels are headed. So they are reassured in the sense that they know that the child is okay and they're not dipping or they're not going into high glucose levels. When it comes to elderly, so this is where you would want to have a check on where the elderly people with diabetes are doing. So these are patients at home, not very mobile, and even access to the doctor's office is at times difficult. So remote monitoring is essentially easier with the help of this technology. You can even have your remote consultations with the doctor if you're not able to have our elderly patient to go to the clinic each time for their reviews. The other aspect is with busy professionals. So on the go, always on the go, with a fast-paced life, you would need to take a lot of micro decisions. And within the context of these micro decisions, which would number to a greater extent every day, every single day. So having a check on where your glucose is headed helps. It helps make better food choices. It helps even nudge yourself to nudge yourself to go for a run today if you've made up your mind, but feeling a bit lethargic, so you know where it is headed. Or if you have planned any other activity, your glucose insights can tell you what would happen if you would partake in that activity or not. It's essentially a decision making tool. It's helping you equip yourself with data, and the data comes into use when we have a constant stream of information. What continuous glucose monitoring does is essentially populate every minute readings. So remember, the device measures glucose every minute, and it populates this data into a curve. And this looks at the highs and the lows. You know what to do when you're going too low. You know what to do when it's trending too high. So these are essentially empowering patients with diabetes to live their lives to the fullest. When it comes to enhancing the awareness in the country, the more we speak about it, it helps. And thank you so much for being the platform for us to spread the message across. But there are health technologies now which help everybody living with diabetes to live their life to the fullest. It doesn't have to be a lot of mystery when it comes to managing diabetes. You know the value every minute, and you're essentially ensuring that patients do take control of their condition.
With respect to type 1 diabetes and diabetes in pregnancy, what special attention do they need to focus on when it comes to monitoring and management?
I would say that these two, phases, one is type 1 diabetes, which you usually see in children. So we have got children from the young age of, say, I have my youngest child with type 1 diabetes who's 8 months old to, the older children and young adults. And definitely this is a very crucial, age. And again, while we are trying to strive to achieve good glycemic control, very important is for these children not to experience hypoglycemic episodes. So, there's a lot of glucose variability that we see. The blood glucose levels go high and then they go very low, and both of them can be life-threatening. So when, a child with diabetes, type 1 diabetes, wears a CGM device, it becomes very easy for them to track, are they going, low, and then take corrective action immediately, rather than experiencing a severe hypoglycemic episode, which can even result in hospitalization. And the same thing for what we call as hyperglycemia, or when the blood glucose levels really go high, And then, we see ketones, and then that could also, if not treated on time, can result in hospitalization, which can become a very expensive, as well as something that we really don't want our children to go through. Nobody likes hospitalizations and nobody would want it. So again, for the parents, it becomes very easy, because for the caregiver, it actually gives them an idea as to how the glucose levels of their child is, especially if they're going playing. And today we have so many children who participate in sports, and we all encourage them. In the past, I know that these children were actually discouraged from participating in sports, going for picnics, treks, or doing anything, even going for a birthday party. But today we know that, okay, we can keep a track on how the glucose levels are, and that information is also relayed to their healthcare provider as well as to their parent or the caregiver. So it becomes very easy. And therefore, it adds a lot of flexibility, so to say. Our children now can enjoy a normal life, just like any other child without diabetes, participate in every activity, and, bring back the joy of life. I think that's the most important thing that we're all striving towards. And it also gives us an understanding as to which meals are really increasing the glucose levels. For example, how is the glucose when the child is having a tiffin in school? Sometimes children with their peers, they would also share their friends' tiffin box, and then you get to see in real time that what's really happening. And we do tell children that, be honest with us, tell us what you're eating. We can guide you in terms of how much insulin to take. And CGM, definitely, I would say it's like when you're driving a car, you need to know what speed you're driving at. So basically, a CGM becomes like your speedometer, giving you a direction in terms of, are you going in the right direction, or do you need to make a switch? So this is something that a CGM device would definitely help us, give us a sense of direction. Now, when we're looking at a woman who's pregnant, I think that's the most beautiful phase of her life. And then GDM strikes, that's the only time I think a woman would eat without worrying about her weight or anything. They think that, okay, this is the time now I can eat. And then GDM strikes, that's gestational diabetes. And now she has to be worried about what she's eating, because what she eats is going to impact her blood glucose levels. And again, at this point of time, having good tight glycemic control is very, very important. When I mean glycemic control, it means good, tight blood glucose control. Now, here you have to be within the desired target range, because if the glucose levels are too high, then that can impact the mother as well as the baby. So for the well-being of the mother and the child, the mother has to really take care that her glucose levels, not only 2 hours post, but even 1 hour post is, within the desired target range. Now, here meals play a big factor, because usually we see that the post-meal glucose levels are usually on the higher side. And I'm sure you'll agree with me that we Indians love our carbs. Whether it's breakfast, lunch, dinner, our meals are really rich in carbs. Come from any part of the country, whether you're West India, South India, North India, um, um, and East India. So we eat carbs. And whenever we eat carbs, that is definitely going to have the greatest short-term impact on the blood glucose levels. So that will increase the blood glucose levels rapidly. That doesn't mean you don't eat carbs. Carbs are not a villain, because they're, again, important for good health, especially in pregnancy. And therefore, how do I manage my carbs in the meals? By ensuring my glucose levels also post-meal are within range. And that is where CGM, again, gives us a very clear direction in terms of what do I eat at breakfast, which is going to keep my glucose levels stable. I'm not going to have those peaks and troughs, because that is something that we don't want. That is called as glucose variability or glycemic variability. What we want is very, very stable blood glucose levels, especially post meals. The glucose levels have to be within the range. That is 1 hour post meal below 140 and 2 hours post meal below 120. So I know, okay, if the breakfast, I'm seeing a very high spike in glucose post breakfast, then can I split the breakfast? Can I have half now and maybe half after 2 hours? And how is the trend looking? And that gives me a good idea. And also the person more confidence that, okay, what I'm eating and what I'm doing is working well to manage my diabetes. And I know my baby is also going to be healthy. Because if this mother does not control her blood glucose levels, then she's going to give birth to, what we call as big babies, macrosomic babies. And obviously other complications also that come with uncontrolled blood glucose levels during gestational diabetes. So here again, tight glycemic control is very, very important. Again, exercise, because most people, they think when they are pregnant, they should not move too much, or, there's a lot of myths and misconceptions around pregnancy, whether it's food, whether it's exercise. But actually, we tell the woman that you should, in fact, post meal, you should be physically active because that'll keep your blood glucose levels in range. So if the lady has eaten her food and then she does, say, a 10 minutes walk, and then she sees that the blood glucose levels are really coming down on the CGM graph, she's very motivated that, okay, this is something that is working and I can do this. And this is something which is simple and easy to do. So that is where I would say these two conditions, whether it's type 1 diabetes and GDM, because again, the frequency of monitoring is very high and it becomes very, very difficult for them to keep pricking themselves. And that is why they prefer a CGM, because you put that device and then you leave it for 14 days, it's there, and you really don't need to prick yourself so much. And it gives you a good idea. It gives your healthcare provider, real-time data. It gives your family member, whether it's a parent or a caregiver, even they know what's exactly happening. So basically, everybody is working as a team and therefore working to improve the quality of life of individuals living with diabetes.
Thank you so much for being a part of Mint Techcetra. Those were some very valuable insights. I'm sure our listeners have learned a lot. This is Kartik signing off.